So good evening, everyone, and all of you are very much welcome to this ISCCM Day webinar. And it is our great privilege and pride as well that we are conducting a very good webinar on a topic which is, I think, all of you are so much familiar that you must have many questions in your mind, many thought process in your mind. And we just thought that as we are celebrating, this is the 30th year of ISCCM, and we must see all those things which we can discuss in this webinar, which are related to social media, because we are now so much habituated to this social media that we cannot live without social media. And most of us now have started referring for all our questions which comes to our mind to the social media. So first of all, I welcome, I give the microphone to our Secretary of ISCCM, Dr. YP Singh, to welcome you all, and then we'll take the proceedings further. Dr. YP Singh.
Thank you, Dr. Pradeep Bhattacharya. I'm Dr. YP Singh, Journal Secretary, and also the Journal's Organizing Secretary for 2024 Calcutta Conference. I welcome you all for this webinar, which was being organized on the 30th ISCCM Foundation Day. I welcome all the participants, all the panelists, and the moderator. So without doing further delay, I'll just hand over to the Dr. Pradeep Bhattacharya.
Thank you, Dr. YP Singh. So, as I said, the relationship of social media, how it helps as far as our critical care knowledge development is concerned. So today's moderator is none other than our coming president-elect, Dr. Srinivas Samavedam. He is the Chief Critical Care Specialist from Ramdev Rao Hospital, Hyderabad. And our panelists are Dr. Rajesh Mishra, is the past president of ISCCM, and he is consultant at Shaibia Comprehensive Care Clinic and Khyati Multi-Specialty Hospital at Ahmedabad. Dr. Kushra Bajan, he is consultant critical care and head of emergency department, Hinduja Hospital, Mumbai. Dr. Sharmili Sinha, she is senior consultant critical care medicine and associate professor at Apollo Hospital, Bhubaneswar. Then Dr. Suresh Ramasubban, he is senior consultant in pulmonary and critical care medicine at Apollo Multi-Specialty Hospital, Kolkata. And Dr. Amlendu Yadav, he is professor Department of Critical Care Medicine at ABVIMS and RML Hospital and Central Government Hospital in Delhi. So I invite all of you and to this special panel discussion on the use of social media as far as critical care medicine is concerned. So without wasting time, I hand over the mic to our moderator, Dr. Srinivas Samavedam. Dr. Srinivas, please.
Good evening, sir. Good evening, everybody. Thank you, Dr. Pradeep and Dr. YP Singh, for giving me this opportunity of taking the discussion on a topic which is not theoretical, not something which is, based on a randomized controlled trial or a meta-analysis, but that has made a deep impact on the way we practice critical care, especially after the pandemic and during the pandemic and after the pandemic. A lot of decisions, a lot of planning, a lot of information sharing is now happening through various social media platforms. And most of us would have either utilized or benefited from the use of this social media platform. So let us understand the nuances and the implications of using a social media, association for improving the delivery of high quality critical care. So I will start with Dr. Rajesh Mishra, who's been the past president of the Indian Society of Critical Care Medicine and has used social media to take the society's policies and its presence to the interiors of this country in the last couple of years. Rajesh, we'll start with you. What do you think are the relevant social media handles which are important for us as intensivists?
So thank you, Dr. Srinivas, for this question. Thank you, Pradeep, Dr. YP Singh, sir, for giving me this opportunity to talk about something which is very relevant and which has been very close to my heart. So, immediately I was General Secretary at Hyderabad when we organized, and immediately after General Secretary, we were hit by COVID, and we took an initiative because we were restricted to our home. So I first started a group, which all of you know is called RCM Academics, which stands for my name. But the purpose was because we were so restricted for COVID that we needed to know what is happening in COVID every day. And when I met that group, I never knew that it will impact so much everybody about COVID, that I got so much of praise about it, that a lot of things and most of the things people learn about COVID from my group. But this was a very controlled group. Now, since Twitter has come, since Facebook has come, LinkedIn has come, and now Twitter X is there. Apart from there, so all the society, or all the people who are having educationalists and who are vocal about the education and knowledge, they have some handle and they keep disseminating the information which is relevant. We are living in the era of quick information, quick, relevant, and immediate information. We cannot wait for the months together that things get published in general. Then you read, analyze, and do the critical analysis and do it. Now people like to listen it, read it immediately, and implement, and want to see what is happening. So presently, if I say that WhatsApp has become university for so many things, for control thing also, uncontrolled thing also, disseminating information and misinformation. So much of information that our intelligence which is needed to filter the information, what is correct and not correct. So the relevance of social media handle is becoming very important. No doubt, it is giving us lots of information and misinformation quickly. How you are going to implement in your knowledge, it's up to the concerned group, up to the authenticity of it, depends upon the authenticity of the group, but it has helped us in updating us. ISCCM, SCCM, ESICM, even CHEST, and all the society has their own social media handle, which at least everybody is on Facebook, everybody is on Twitter, whatsoever somebody follows, and whatsoever they find is relevant and everybody should know quickly. Even NAGM, everybody post that. Even nowadays, what happened, people have started putting in formatographics on one just in one information, key information is loaded and it's put on Twitter, it's put on Facebook, it's put on LinkedIn, even their fast WhatsApp group. Even one more thing I found, in WhatsApp, people just update their status. Suppose I want to give some information and I am being followed by X number of people, I just change my status, and that information also is seen by everybody. So no doubt, social media has helped everybody to reach fast, give appropriate information fast. Now, how much that information is appropriate, how it has to be implemented, it depends upon the way you perceive all information, how much you can implement and how to implement. It depends upon the receiver. But definitely, it is impactful, and definitely authentic groups. It's not only my group, there are other groups also works, and they helps in, now I see that a lot of society have their own WhatsApp group, because in WhatsApp group, even Telegram, ISCCM has Telegram group. So no doubt, all these groups are helping a lot in disseminating information fast and helping people.
Okay.
So
yeah,
that's all from my side, Srinivas.
Yeah, Dr. Amlendu, we have heard Dr. Rajesh Mishra speak about what.
Srinivas, sorry to stop you. Khusrav has raised hand, but Amlendu, you can ask. Sorry.
Yeah, we'll come to Dr. Khusrav after we finish with Dr. Amlendu. So Dr. Amlendu, Dr. Rajesh Mishra spoke about WhatsApp. He spoke about Twitter. What else? What other platforms do you think are, some impact generating platforms for dissemination, sharing, and compiling of information as far as critical care is concerned?
So first of all, thank you for the selecting me as a panelist, and good evening to all the panelists and the moderator and the dignitaries of the ISCCM. A major part has been already covered by Dr. Rajesh Mishra. Just to complete the list, Twitter is one WhatsApp is, Twitter is one which is not restricted by the numbers. WhatsApp is one which is restricted by the numbers. To complete the list, they are the next LinkedIn, where we share our professional networking. There are next, to name the next is YouTube, where we see the lectures, the video lectures, and we can subscribe to the relevant channels which has a large number of subscribers, and the channel which has provide the authentic and relevant information. And like we are using the other social network for this webinar also. The other is Facebook. Facebook is another platform which is not restricted by the number of participants. So there are, other than these, there are websites which are relevant to us, but because today's topic is only for the social platforms. A little related to it is podcast, although not exactly a social media, but yes, it is one another platform where it provides a lot of good information. So I have shared a list of social media platform with Dr. Srinivas. It is more than 50. I'm sure it is more than 50 I have shared with Dr. Srinivas, and it is, I think, more than 50 social platforms providing relevant, they have their own niche, like Instagram. Instagram is where we share our visual knowledge, right? And infographics, as has been mentioned by Dr. Rajesh Mishra. So this is the most commonly used platforms, social platforms, which are currently in use.
Okay, we'll take Dr. Kushraw's comment on this.
Yeah. So I think Dr. Rajesh and Dr. Yadav have said adequately about which social medias, but I would just like to add a point that social medias were very social before the pandemic, and we used to use it on and off. But after the pandemic, after the COVID, it's become mandatory for us. So we cannot really, as Rajesh said, we cannot do without social media as doctors in our profession. Just to add to the list, there is Twitter also, and Twitter is quite nice because you can follow a liking that you want. So you can follow a single person. If I want to follow Amitabh or somebody, or even John Louis Vincent, I can actually follow that and see what is the latest in ISCCM. So similarly, Twitter is very good. And there is another format, the list goes on, but I think we should all be also aware of FOAM, which is a online access for medical information for doctors. So FOAM has critical care, FOAM has emergency medicine, and FOAM Ed or FOAM CC is one of the other very good platforms. So just wanted to add that to the list.
So we'll stick with you, Dr. Kushraw. You have multiple hats. You know, you are intensive care, you are into emergency medicine. So how helpful in your practice, from a personal perspective, in the last 3 years or 4 years, has social media been? How do you think it has impacted your practice?
Yeah, so I think social media has definitely helped us. I come from an era when there was almost no social media, and now it's like a second phase of life and career for me with the social media on. It definitely helps me to learn, to disseminate knowledge, to even teach students and share views and even case-based discussion. So I feel social media, if used appropriately, and the formation of the group, if done properly, is excellent. There could be groups in the social media like WhatsApp, etc., as mentioned, or you could have an overall platform. And I would like to put this into a small mnemonic. The mnemonic would be cuddle. So social media helps me to communicate, C for communicate, U for updating my knowledge, D for discussions and all groups, L for learning and ongoing learning, and then E is for education and for evolving ourselves. So I think if we use this cuddle kind of mnemonic, we are going to be using social media in the right way, and we can cuddle it up.
Yeah, so intensive care is all about giving fast hugs and cuddling people. So it looks good.
Nice one.
Good. We'll go to Sharmili. Sharmili, you have been very actively involved in academics. You have been involved with the our newsletter. You've been involved in our website planning, and you're going to be the vice president of the society very soon. So how do you think, from your perspective as a professional of so many years of experience, social media has impacted your practice?
Thank you, Dr. Srinivas, and thanks ICC for this opportunity. I think most of the aspect of the question has been covered by my previous speakers. And as far as I'm concerned, in the era of critical care and social media, all the platforms that we have followed, we have been already deciphered, like WhatsApp, YouTube, Facebook, Twitter, Instagram, everything I have presence somewhere or other. And mostly WhatsApp has been the medium where we have come across most of the exchanges, mostly related to education, research, and even regarding the clinical discussions time to time. Any part of the corner of the country and the world, we can connect. The RCM Academics Group, which Dr. Mishra mentioned, has been an excellent platform which we started in the initial part of the COVID pandemic. And any kind of difficult question or clinical scenario we come across, we discuss that. And even you have an excellent group of HICS, Hyderabad Intensive Care Symposium. That is also, I see, an excellent platform where we discuss cases even on day-to-day basis. Similarly, we have presence in the Twitter, Facebook. ISCCM, being in the communication committee coordinator, has presence in mostly the 4 handles of social media, mostly the Facebook, YouTube, Twitter, LinkedIn, and Telegram. In Facebook, I'm glad to share that we have more than 10,000 plus followers, and closely followed by YouTube, which has got more than 3,000 followers. We have in Twitter also around 2,200 followers. So all these platforms, apart from sharing education, information, and research, and about the disseminating knowledge about information about all our activities, also we exchange many kind of about the upcoming activities and about not only national and global conferences, etc., also being shared. Regarding my very personal practice, I would say on the virtue of belonging to a state where probably communication and the state was badly hit by COVID pandemic, we had many patients who would try to reach us from many corners of the state. They didn't have good infrastructure. They did not have means to reach or access healthcare. This telecommunication, mostly by the means of WhatsApp, actually could contact and provide some services during those periods. So I would say it has been tremendously helpful. But on the flip side of it, I would say there are also occasions where we had faced actually challenges or disadvantages, because something when we are communicating through the medium of WhatsApp, and you have typed some responses like my sugar is high, how much insulin I need to take. A simple question like this, at 10 p.m. somebody rings you, sends you a message. You cannot just, if you write, say, just reduce your insulin or do not take or take this much. Then something I really worry, like if something happens to that person and next day it can be always challenged. And once it is there as a text, it can be utilized. I mean, it can, in case any complication arises, it can be made viral and it can always be utilized against you. So there are, when we have using it to an advantage also, we must keep in our mind, there are limitations, boundaries. That's all from my side.
Okay, so a comment from Dr. Hemant. He says that apart from staying together as a family and professional group, the most important role is academic reach, and latest journal papers, interdisciplinary science reaches us to explore depending on what you follow. I think this is what Rajesh Mishra said when he said a lot of journals now put up graphic abstracts so that it catches your attention and gives you the gist of information in a very short span of time. Point taken, Dr. Hemant. Thank you for putting that. Dr. Amlendu, you would like to add something? Could you please unmute your mic?
Yeah, I would just like to summarize how it can be helpful. It will be helpful in my medical education, upgradation, networking, collaboration, case discussion, patient education, continuing my medical education, my professional development. Social media can be used. Research and publication I can share with on the social media, and the patient engagement. This is one medium where we need not to make the patient understand, sepsis patient understand the same thing. We can share the whole information about the sepsis on the social media, and that we can just say that you can get a lot of information from this handle or this side or this way. Another very good utilization of social media. This critical care is not a field of everyone's. This is not everyone's cup of tea. This is all stressful situations. We are working, we are stressful. So this social media platforms can be a medium to share our stress and share our burnout, so that our seniors, our peers can guide us how to handle such situations. This also, social media has a very essential role. It has numerous benefits for the healthcare providers in critical care medicine. It is crucial to use these platforms responsibly and in a mindful way.
So we'll come
yeah.
come to that. We'll come to that point during the course. We'll go to Dr. Rajesh again. As he said, he's been one of the leaders, pioneers in actually integrating all opinions from across the world. If you look at his WhatsApp group, there are people from Europe, from United States, from Latin America, from Africa, from Sri Lanka and Australia, who are listening, watching, reading what we are discussing and where we are headed as a community, a critical care community. So Rajesh, you are a responsible administrator and you are a very strict administrator, as I know. So what are the responsibilities you think a group administrator, what are the responsibilities of a group administrator? How do you vet the content? How do you decide what content gets posted? And how do you step in when the content does not keep pace with the tenor of scientific medicine?
So, Srinivas, the literal meaning of responsibility is ability to respond properly. And when we talk about strictness, ability to respond properly comes as a part of strictness or whatever you say. So when you are 500 expert, who may be equivalent to 5 million people also, has put faith in you, something who stays with you for 3-4 years, only on condition that this your group will be purely academics, we have certain responsibility, because when you put something, everybody sees there. And if we put something irrelevant, which is not relevant to everybody, that disturbs them. And very commonly, then we used to get a message, Dr. Mishra, this is not appropriate. So, so it's a consensus. It's a consensus that what we should be putting and what we should not be putting. So, with time we evolve, that let us focus on something which is of interest to everybody, which should be logical, which should be something which helps in changing your practice, which should be help something new coming to, and everybody should be knowing, but simultaneously taking care also that we should not be putting something which disturbs your time. Your time is precious, because at the end of the day, it's a time. Everybody sees my group. Even for 2 minutes, you see that 2 minutes precious you have given to the group, and if you are not getting something which is relevant for you, probably would not like to stay over there. And that's why most of the group do not last. Anybody who is really serious about academics, they do not stay in group. This is one of the reasons. So I have not been strict very clearly, Srinivas. I have been responsible and tried to carry on a responsibility which you all had bestowed on me, that this group will be more or less academics, though sometimes, because a lot of people say you are too strict, so sometimes I become lenient and try to give people liberty to put something, but most of the time I try to keep to the academics. Now coming to my responsibility, that I have certain goals there. I have met this group that information related to scientific, particularly critical care, will go to the people who are in this group. Those should be academic, authentic. People should not be saying anything what they like. There should be some relevance. And that's where we look at. And if somebody is talking irrelevant, and somebody talking, which is defamatory, or somebody is putting something which put division in the society or something, that's where our responsibility, we should not be allowing this kind of message. So what I look at, that you give authentic, truthful, or whatever you give should have explanation over there, and which should be helpful for the people who are there in that group, or in any group that applies to any group. Simultaneously, as the admin or administrator of the group, I have a responsibility. I should not allow something which create division in group, which even disturbs one member of my group for whatsoever reason. Even one member has complained to me look, Rajesh, this is not appropriate in the group. And I have personally tried to convince people privately, don't do it. And if they have not done, then I had to remove those messages. That I have also done. So that kind of thing, like here is not a democracy issue. It's an issue of that if 550 odd people trust you for something which will be relevant, authentic, and they will not get disturbed for unnecessary thing. They will not get disturbed for good morning, good evening. They will be disturbed only something which they will read and tomorrow they will implement in their practice. So the simple rule is allow something which is physiological, authentic, scientific, but do not allow something which creates division in your society. Do not create something which is defamatory. Do not create something which hurts anybody's sentiment, even one person. Do not allow something which creates any kind of division in the thing. Though you try to be strict, sometimes it happens. And if something has happened in past, I have also apologized to the people like, look, there's sometimes things goes out of control, but yes, more or less, almost we are running in 5th year of it. And we have been well in control, and that has been a success of, I mean, one of the reasons why my group has been so successful. And a lot of people compliment me when they meet me in person that we stay there because something we learn, something or very often we learn something. So that has been credibility of my group, and being responsible and little strict, I could create this thing.
Okay. So with responsibility comes liability. And Dr. Sharmili did raise the point of medico-legal implications of the social media. So we'll put it to Dr. Sharmili. How liable do you think is the administrator of a platform or a media handle for the content and its implementation? Suppose somebody gives an advice on a WhatsApp group to treat a particular disease with a particular intervention, and it goes wrong for the patient. And how do you think what is the liability? This is a point one, already raised by Dr. Ritul Chopra on the chat box. So I thought I'll extend that to you, because since you first raised the medical legal aspect for the first time in this discussion.
Yeah, I think that's a very important point, and it is very common as well in terms of incidents and in experience of all of us. So I'd say I'm not aware if there is any standing rule or law in that aspect. I know there are rules and regulations pertaining to telemedicines, teleconsultations, and especially they were also revised when COVID started in the government of India. Not many rulings and notices we had received. But in terms of this usage of social media, I mean, that was only for consultations. But for social media, commonest example being WhatsApp consultations or discussions or some kind of assurances or chats. There is no standing rule or regulations on that. Having said that, I would say sometimes more of us, like physicians, surgeons, we are morally bound. We morally get compelled to provide some kind of advices on the WhatsApp platform. And sometimes we tend to, like, suppose for fever or extreme pain, you probably tend to write some painkiller. Then what kind of painkiller you're writing, if it is a plain paracetamol or consisting any non-steroidal anti-steroidal drugs. But we are not sure if that patient, what is his renal status or what is his otherwise clinical conditions or other comorbidities have been. Suppose after 7 days that patients develop acute kidney injury, lands up in a hospital, we do not know. So I think there is no standing rule, and that's why it makes it even more imperative on the person, on the physician, be careful about WhatsApp consultations. You can give general advices like take care, or you go to, if there is an emergency, if you're feeling very sick, go to consult the nearest physician or visit the healthcare setup instead of writing any prescriptions. But most of us, having said that, again, because we are all social human beings, we have very close friends, families, we live in a society, we feel sometimes, socially obliged to mention some drugs or other, which they go and show probably to a pharmacist, thanks to our, drug dispensing policies, and they just give this anything for that matter. So regarding social media consultation, there is no standing rule. But I think regarding the website, there are regulations like ISCCM for my society, for our society. We have a website, and there are written rules and regulations for that. And anything going wrong in that platform, the administrator and whoever is the head of the organization or institute is legally bound for that. But lots of universities, if you talk about, I'm talking about making some statements on YouTube or posting some case discussion on the WhatsApp, Telegram, or Twitter. I do not think there is any liability, but as Dr. Mishra rightly said, if it is mounting or overlapping into anybody's defamations or leading to revelations of anybody's privacy, confidentiality, etc., that can be subtly be objected to. And you would have noted that many times we go just emotional and start discussing cases, because we all are clinicians, we love discussing clinical cases. Reports, when they're posted in the social media, many times we just forget to scratch the name or hide the identity of the patient or the hospital. So, or even, some we are showing a patient, there'll be some surrounding or ambiences that which will probably implicate or reveal a bed number, one kind of hospital's logo on your dress, or in the nurse's board is there. There are some videos on the social media you'd see, I have come across, where they're examining patients, probably trying to elicit some certain signs or kind of certain test, important terminal test on patients. Patient's identity is not hidden. And those kinds of, they have subscribers probably in thousands. So I think those are potential threats. We love to discuss and disseminate information and knowledge, but we actually tend to ignore the other side of it. So I think there are no written laws, but it is time till then we consolidate ourselves, we behave responsibly and know where our limit is.
Okay. So I welcome Dr. Suresh Ramasubban, just joined us on this webinar. Welcome, Suresh.
Thank you, Srinivas. Sorry about the traffic got stuck on the way.
Srinivas, once you finish with everybody, I just want to have few comment about the medico-legal aspect if you others have said that.
So we'll
everybody said.
We'll just take Dr. Amlendu's opinion on the medical, on the the liability of the administrator, and then we'll come back to you, Rajesh. Okay, Dr. Amlendu, please.
Thank you, sir. Depends. Liability depends on several factors actually. Whether that include the specific circumstances, jurisdictions, applicable laws. Generally, group administrator is not responsible for the members who are posting something which is not relevant. So basically, an administrator has a responsibility to control the contents and display the policies, platform policies, and make members aware of the legal responsibilities and the legal jurisdictions, what laws permits in that area or in that country. And the administrator should put a disclaimer on the group discussions or the handle, so that all the members are aware of the rules and regulations of the group. The administrator should moderate the group and should provide a transparency in the group. The rules should be equal for everyone, and it should be transparent for everyone. And in case some legal issues arise in the group or a handle, the administrator should be free to consult the legal expert. That is my opinion about this topic.
Rajesh, your views, please.
Srinivas, sorry, I'm coming. Srinivas, so first we have to understand what we are talking about medico-legal issues. So medico-legal issues applies between because we are a service provider and patient is a consumer. And so when we discuss about the social media, something is being discussed on YouTube, any of the social media, it is me who is reading and trying to implement it is correct or not. It is my responsibility who is implementing to first understand whatever is reading is correct with his understanding and then implement. Because at the end of the day, I cannot claim that I read this on this media or anywhere. And even for the sake of that, nobody asks until unless that become a standard textbook. If you read something experimental thing and you do with your patient until unless you have taken ethical clearance, whatever you do, you become responsible. So first we have to be very, very clear that whatever anything is being discussed on social media, it is information, thousands of wrong or right information which is being given, and it is our responsibility. Whosoever is taking that information is the responsibility of that person to authenticate it, understand it is correct or not correct, and then take action. It's like that. So many things comes on WhatsApp, and if you start reacting, Tomorrow, anything can happen. So second thing, like patient read a lot of things on Google and they take medicine. Whom they are going to sue? Google? No, they cannot sue. Google is not. Google job is that whatever information is there, Google says the same as the social media information comes with a clear-cut disclaimer that you cannot sue on the social media or WhatsApp group. I read this on WhatsApp group and then I have implemented it wrong or right. No, it's not.
Rajesh,
No.
just interrupt you. You use the word medico-legal issues, right? One of our senior colleagues, Dr. Jay Prakash, has raised the point that a medico-legal case like a traumatic brain injury or a burns or a trauma or a poisoning is a medico-legal, situation. And as long as the treatment is going on, it is considered as in the court of law. So can the information related to such cases be openly shared in a social media platform? This is a concern.
So let me clear. So now this one I was discussing about what we discuss scientific knowledge.
Yeah.
Now discussing about the case on a group. As long as you discuss this anonymously, not disclosing anything about the patient's whereabouts, his name, his identity, any case you can discuss for, because you discuss those things where you are stuck and you think that other colleagues who has experience, they will share the knowledge and something you will get out of that and it may help the patient. But as long as you do not disclose the patient detail to any media, not post his photo, not post about that which hospital he is in, not posting his about any detail, you are absolutely fine to discuss any of clinical condition on any, nobody is going to stop you.
So,
and when you implement those knowledge, it is your responsibility how you are implementing. Because I implementing something and else, but I may be saying you give normal saline 500 ml. This is one information I give. But how to give, whom to give, whom not to give, what underlying you have to, it depends upon the person who is implementing.
right.
So you cannot sue somebody that I said you give 30 ml per kg of the normal saline. I said you give.
Dr. Kusrao has something to say on this.
Underline also. So you have to understand, do not misunderstand, please. The information shared on media has any MLC implication because it's information. How you take it is important and how you are implementing it is important. Nobody is going to sue you why you are seeing on this thing.
I think we are just fretting and fuming about the medico-legal. Dr. Rajesh and Dr. Sharmili made excellent points about the administration and the medico-legal, but we should divide our category of social media into 2 or 3 categories. One is only disseminating information, articles, scientific knowledge. The second would be where you are discussing a case, and as Rajesh rightly said, you can discuss a head injury or poison, but don't reveal the identity nor even reveal the hospital where they are. Just say it's a case just for discussion and not a real life case. So then you are medically safe, medico-legally safe. I disagree with just Dr. Yadav here that the burnout is definitely there, but that should not be allowed. Rajesh would agree with me as an administrator in the group, because then everyone will start saying today is a dull day and a boring day and stuff like that. Secondly, the medico-legal issues will happen only and only when you are writing a prescription, as Sharmili said, to a single patient. But I refrain from doing that completely, and because it gets on my nerves. If I write, say, ibuprofen for once a day, the next message will come, how long? The third message will come, can I give it to my husband also? Whenever he has a headache. And it's a never-ending saga. So I refrain from it completely. But sometimes, as she said, you might have to write a few prescriptions, but there you are medico-legally liable. So why should you do this service? I mean, you say, when I say that you check with your local doctor for headaches and fever, and in any emergency, please report to the emergency department or the ICU of your nearby hospital. Okay. That's what I say, and I think I would be reasonably safe there.
Okay, we'll give we'll start bowling to the new batsman, Dr. Suresh Ramasubban. Suresh, you wear multiple hats. You're a neurointensivist, general intensivist, you're a pulmonologist, you have your own practice. So you must be getting a lot of these queries about patient care from multiple aspects. So, and Rajesh did mention about identity of the patient, patient privacy, and his own confidentiality. So how do you think we can protect patient privacy and confidentiality while trying to seek information from open platforms like the WhatsApp or X or Telegram or any one of those channels? They're open platforms.
Correct. I will tell you the hat that I wear and the forum that I love to interact with is actually sleep. So the American Association of Sleep Medicine is a wonderful forum where they discuss, say, a complex case of, say, somebody who's not getting any complex patient with Parkinson's disease who also has restless leg and so on and so forth. And people are trying different drugs and something of it. So I think there is never the mention. It is very, very clear that you never mention the name or the identity of the patient. It is a clinical question that you have, and you can put it up on the forum with giving a detail about the background of the patient. And you have absolutely cannot disclose any information pertaining to the patient. That privacy has to be maintained, that patient's information cannot be transmitted. So I think otherwise it's fair enough to ask my colleague that I am stuck with a patient or I'm stuck in a clinical conundrum and I need help. But only thing is you just cannot have the disclosure of the patient information.
Okay. So we'll go to Dr. Sharmili again. We all heard about all good things about social media, the good things it can do and the help it can do to everybody. But I don't think anything is without hazards. Anything. You drive a car, there's a hazard, right? So what do you think are the hazards of using social media for therapeutic guidance? What drawbacks do you think?
Yeah, I think we have discussed about the medical legal at length, and I think still more can be added to it. Second part is about the authenticity or the validity of the information that we obtain from the social media. As Dr. Amlendu said, he has probably posted you 50 such online forums, and there's a forum, and the count goes on. There are so many platforms to derive knowledge from. Then you do not know what is the authenticity of that information. How valid is that thing? Like Dr. Suresh just mentioned about, you have stuck with a clinical case, somebody, 5 or 6, I put a clinical question scenario and 5 or 6 colleagues of mine give their opinions, how they want to handle it. Then what I do, of course, as Dr. Mishra said, it is my prerogative. I have to consolidate those informations, the patient's clinical conditions, the infrastructure, and the patient's financial status, and I take the decisions. But I think it is also confusing at times. And many times you feel that you can do probably if you think about some kind of poisoning and the plasmapheresis, plasma exchange can be done. Those kind of things also under very desperate situations strike us, and you feel like you can do those kind of things and get wonderful results. So I think there is a flip side of it that sometimes there is bombarding of information which you feel like drowned with. It confuses. So I think we should stick to our basic practices, clinical science, and the regular things common things that we do. At the same time, while trying to derive information from these platforms, what is best possible under circumstances customized to your scenario and your patient, that should be done. And other thing is about the authenticity of the information, because sometimes if you look at this, Google about, say, C deficit, Clostridium difficile management. Patient has, suppose I had encountered a patient sometime who has got very bad abdomen, toxic megacolon, patient was in septic shock. Fluoxamine was not available that time. But if you explore internet, you find that is the thing which has been FDA approved and probably the cornerstone of treatment as for this latest recommendations. But you do not have it. Then the relatives come and ask you, this is the thing, why you do not have it, and can you export it or import it from somewhere, and take consultation from higher centers as regard what to do. So those are the flip sides of it, which actually sometimes puts you under stress about how you can go beyond your stretch, beyond your limit. And that's how I put it like.
Okay, so Sharmili, I'll stick with you. You have been part of several surveys done on social media in the last couple of years, some of which were published. Good quality surveys were published, which data was collected from the social media and analyzed, and as any other data would have been analyzed, you have analyzed them and published them. Now, there's a comment from one of our senior colleagues saying that we should trust on authentic and verified articles, guidelines, protocols, and good journals. So if you collect data from a social media platform like X or WhatsApp or any other channel, what is your perception? What is this? We'll ask this to Dr. Rajesh Mishra as well. What do you think is the scientific relevance and reliability test of the data collected by such surveys? Can they be authentic? Are they biased? What is your perception? You've been author of several such surveys, so I thought I'd ask you first.
Yes, yeah, I did conduct actually a difficult survey during this COVID times, which got delayed also because of the pandemic. But I would say we used or took help of the social media to float that survey, to reach out to my colleagues in different parts of the country and to collect their responses. That particular survey or the other kind of survey that I see my colleagues from different parts of the country are doing, circulating, they are not deriving information from the social media per se, but they're taking help of social media to circulate those survey, Google Forms or any other kind of formats that they are using to collect information. So that way social media has been very useful. But the other side of it, if you mean that what is the information which are shared or the studies which are shared that this survey conducted and this showed this and that is again the big question, that what is the validity of those kind of informations? Because there is no peer review services available for those kind of social media publications. We do not know who have really gone through that, checked this data collected or not, analysis what they are claiming to. So this certainly remains doubtful. Hence, that is why I would say at this time of things, while we are trying to explore the world, we still stick to basics, clinical common science that we have been taught, we have practiced over the years, and what we have stood the test of time. Instead of trying to entirely changing our practice based on the information derived from this social media information or the service. But I would definitely reiterate that this social media have been very helpful during those COVID times. And even now the trend continues to circulate you and popularize your service, because suppose from ISCCM, we had around 12,000 or 13,000 members, live members in 2020. And we circulated the surveys. Probably, I'm not sure how many of you are getting time to check our mails. Probably responses was not good. But when we started circulating in the WhatsApp media groups and various other platforms, we did get good responses. So that way I would say to get it, but information is certainly, it has to be weighed before we accept and implementing their practice.
Rajesh, your viewpoint on this?
So, Srinivas, again, I will say information being disseminated, unperceived, the two different aspects. As far as we are concerned, we collected, we are collecting data to social media is absolutely fine, because we are controlling a controlled data. We are not collecting data for everybody. We are collecting data with our ISCCM member. Social media platform is being used to reach to them. Okay, this is the question. So the question is being answered by the people who have some knowledge or understanding or some basic knowledge about the things what we want to know. So definitely, if they are putting a question on authenticity of those people, then you can definitely put the question of authenticity of the paper. And if you have a trust in the people who are answering, then there is no question. Because survey is survey. Survey, you have 5 options in your mind. You are asking certain question and you think the person will answer to the best of his capability, whatever he is doing or not doing. So I do not find any reason being refrained from, because now everybody using it. Everybody is using to reach maximum people this social media platform, and we should use, provided it is controlled and you know who is responding. If you are taking from general perception, any question from general public and answer and giving fake answer and trying to fabricate the answer is a different issue. That we are not doing. We know that what we are doing, because we are doing it from our members and the people who are our society member. Only thing social media is being as a reach platform. Now coming to the question of that anything, any opinion giving everything should be taken from guideline or research paper or RCT or thing. So let me tell you very clearly, Srinivas, you also know, and we also know, that we do not have evidence or guideline or research paper for everything we do. In critical care, the day we started realizing that everything and every moment is new, and every moment you cannot make guideline for everything. So every time you need to apply your clinical skill, whatever you understand from your basics of the medicine, to upgrade. So just following blindly anything, maybe any RCT, maybe any scientific paper is not correct or correct, I cannot say. That's why I'm saying to filter the knowledge. There is hundreds of and millions of knowledge is being bombarded. It's our job to filter the knowledge. Now patient comes reading Google, his symptom, he knows. I have cough, so these are the possibility. First he read, he comes to you, I have cough and I may have this thing. So now your job increases to tell him, you have this and you don't have this. So our responsibility is increasing in the current era of AI and Google. So you cannot blame that. We have to live with this. Provided we have to get smarter in filtering the knowledge, what is appropriate and what is not appropriate. We cannot go away at least we cannot go away right now from social media. We have to live with it, and we have to live with it happily. It's like marriage. Whatever is the condition, you have to go on.
Okay. We'll go to Dr. Suresh again, and we'll ask him, can you recollect, after the entry of social media and the sharing of information, which has exploded in the last 4 years or so, can you recollect any major changes in your practice? Can you quote offhand what changes in your practice have been brought about by your utilization and your access to social media?
No, I don't think there has been any major change in practice. As I said, one of the biases, in fact, I would be very little, give you an example, would be the fact that, say, for example, a device for treating in COVID. So let's look at that. And there is a whole gung-ho about this is the best way to go ahead and treat COVID. And that filters through social media, and you get biased in referring patients to or doing those things. So I think what social media has done as far as practice change is concerned is, if you're looking at state-of-the-art stuff, it has brought to everybody's attention what is available. So yes, if I need a lung transplant, I know that this institution does it in Hyderabad. I need to send this patient here. So yes, it has made information available easily in our practice. But I would still rely on a peer-reviewed journal rather than information that percolates through social media, because we tend to publish only our social media is only a paragon of virtues. It is not a paragon of any misdoings that we do. So I'm not only going to put up, I'm going to put up on social media or on any WhatsApp things which have succeeded, which may or may not be evidence-based. So I think which has not been peer-reviewed also. So I don't think practice has changed based on social media in the last year, despite the fact that everybody with ChatGPT or anything, anybody can access any information as to what is the best treatment for a particular diagnosis. I think we still I would still use an UpToDate or a Dynamed or those kind of search engines to get myself knowledge about a particular thing. I won't do a general Google search to get information or a general ask my social media to treat it if I have a question about any particular disease. So I think, yes, I can extrapolate this question and say, how has information technology changed myself? Yes, information technology has made it available on my hand where I can access it, but not necessarily social media. Because by the definition of social media, I'm talking about interacting with colleagues or peers or with the public in some platform. So I don't think that has changed medicine, but what has really changed medicine is the ability to get information from us, from peer-reviewed sites, from good sites. I can access like end-of-life care. I can just immediately look at the ISCCM guidelines on end-of-life and answer a question to anyone rather than to a patient, rather than to look up in general or ask somebody what needs to be done. So I think I would rephrase it that practice has changed with information technology and with the availability of this thing, but not because of social media. That's my personal experience, personal take on this.
Okay, so there have been a few suggestions coming from one of our senior members, Dr. Ziyakov Joshi, and Dr. Joshi says that the ISCCM should come with online guidelines on their website, and every new guideline should be updated on social media. Fair point, well taken. And he feels that the ISCCM news for public awareness should also come on social media, and the awareness campaigns and prophylactic and prevention healthcare tips the ISCCM should update to public by our team. So we will go to Dr. Khusrao and we will ask him, of course, his opinion on his practice changes, but also his viewpoints on what are the key areas where ISCCM can use the social media to popularize the specialty per se and the activities for the community which the society is doing. What aspects do you think the ISCCM can capitalize on the virtues of the social media? Dr. Khusrao first, and then Dr. Amlan.
Thanks, Srinath. I think there are three quick comments which you were asking me about. Before I answer this, the first is that, as Rajesh said, there is Googleopathy now. So we have patients who suffer from Googleopathy. They check on the Google and they come and ask us. And as Dr. Suresh mentioned very correctly, all the panelists and everyone who's attending this workshop or CME discussion always believe in peer-reviewed journals, and we do our bit to follow our clinical guidelines. So I don't think we get carried away by WhatsApp or any other group, which rightly said by all the panelists is mainly used for dissemination, discussion, and reaching out to more people. Also, it might be very useful to use these media to carry forward certain events. As you asked for ISCCM, what can we do? So certain events, the calendars, the conferences coming up can also be shared. So people are all aware with the platform, what is going on. It should also need to have a reliable information. It should also have credibility, and also the ISCCM as a handle in the social media should make sure that it is reviewed by a set of people. Like we have editors for any journal, we should have about 3 or 4 people who are essentially going to filter the information. So I think ISCCM can definitely use these handles for dissemination of knowledge, reaching out to more people, make specialized groups. So like if you have guidelines, or if you have even workshops to be done, then specialized groups, and that may not go out to each and every person. So there would be a core social media for ISCCM, and then there could be a lot of subsets for ISCCM discussions. If I just very quickly, since we were talking about the credibility, the reliability, I know today's discussion is all are expert based, but I did a little reading on this. There are 2 terms in whenever you use a social media, and that is SMC and TPO. SMC stands for social media credibility, and that actually says that how much does the reader believe in the information provided in that social media. Is it reliable? Is it accurate? And is it free of bias? So there should be an SMC code there. And then TPO basically means how much do you trust your other colleagues who are participants or users of the same group. So there are some technical terms to know your credibility and reliability of your social media. So I think if we go correctly with the right purpose, we should be able to disseminate ISCCM knowledge to all the members across India and now even across the globe.
Dr. Amlendu, your views, please, quickly. Can you unmute, please? Can you unmute, please? Dr. Amlendu, please unmute.
Yeah. Sure, sorry. So critical care physician and critical care society can leverage social media to popularize the specialty, critical care specialty, and promote the activities in several key areas for education purposes. See, there can be a single platform, but there can be a different tab on it. Like if I give you an example of ISCCM, we are talking about just the physicians or intensivist aspect also, but there is patient aspect also involved. So there can be a tab on our ISCCM handle where just the physician will discuss the issues. There will be a patient tab where the patient related issues, where patient can share their testimonials, their stories, their experiences in ICUs. So this is one aspect of it, where the same social media handle can be utilized for different purposes, but different aspect of it, physician aspect and the patient aspect. The same social media platform can be used for public health awareness, for events, popularization of events, awareness of the events, conference informations, research innovations. For just as has been mentioned by one of the participants, the same platform can be used for guidance, guideline propagation, guideline discussion, best practices, and discussion of case studies, clinical scenarios. The same platform can be used for professional development. It has been used, the authentic platforms have been used during the COVID time for dissemination of information. This platform can be helpful in collaboration. making a collaboration, because these are not geographically bound. These platforms are available globally. So these platforms can be used for collaboration purposes, research purposes, and for community building. It will create a sense of community among the critical care physicians and the patient. So there are many uses of it. The same platform can be used as an authentic platform for media information dissipation. So media will understand this is the platform, this will give the authentic information. So and it is not just it, we should also realize what we are doing on the platform. So these platforms data should be analyzed. Who all are using? Are the members really authentic, or they have been encroached by robots? This is common. This get deviated, because in future robots will control these platform also. So that tab has to be we should be aware of such things happening in the on the platforms.
We'll go to Dr. Sharmili. We'll take her views on this.
Yeah, I think more or less we have expressed all aspects. I had certain comments on the previous speakers' statements regarding this peer review services, lack of peer review services for this on the social media contents. There are some tools being developed in addition to what Dr. Kushra mentioned, like SMI, that is Social Media Index, and HON, Health on Net Code. So in future, these tools will be utilized and probably tagged on to those kind of informations when we see it on the internet. Second, regarding Dr. Amalendu's comment about ISCCM's role creating a patient tab, we did actually create that. Dr. Rajesh Mishra was president-elect that time, and Dr. Govil was the sitting president. We had a patient tab actually of some dedicated time on a voluntary basis. We invited involvement from the critical care physicians across the country, and they devoted time to consult patients and even their relatives on the issues related to COVID and afterwards. But I kind of disagree on having a window or a tab for sharing stories, because it can play as a double-edged sword, because any complications or negative consequences can really tell upon us, and it will be really difficult for us, a professional organization, to handle those. And regarding ISCCM reaching out on those, a couple of my senior colleagues also have commented on taking leadership in spreading educations, guidelines, etc. I think ISCCM has been doing it consistently. It has increased remarkably in the last 3 to 4 years. Even Dr. Srinivas is also, he was a COVID time General Secretary, so he has done it more than anyone else. So it has, and it's been increasing in leaps and bounds. I would appeal that all our panelists and all the viewers and other colleagues to appeal all your students and your colleagues to follow ISCCM on the 6 social media platform handles that we're attaching with all the outgoing mails and all kind of flyers, and even on the website, to increase our viewership and followers.
So we'll a little bit of digression from the topic. Just to conclude, there is a query from Dr. Reshu asking about the role of ChatGPT. Suresh?
Srinivas, once Suresh has asked, just give me 1 minute, because I just needed to clear something. Okay, but let Suresh say something, and then I'll
we'll come.
I think we're just not closing now. You have time.
No. I'm coming to you for closing comments, okay. Rajesh. You will have the final word on all this. Okay. Let Suresh talk to us about ChatGPT. How does it compete? I mean, because we are talking about social media, we are not yet talking about artificial intelligence and ML platforms. We will probably have a separate session on that. But how does ChatGPT compete with information sharing on social media platforms? Machine generated advice versus individual generated advice. How does it compare according to you?
Yeah. No, I think the one thing is ChatGPT, which is now available for most of the users, is 2000 data is up till 2021, I believe, if I'm not right. The ChatGPT, the professional version, is which is up to date information. So there's a lag of a couple of years in the information that ChatGPT professes to tell you. So if you want information, anything about treatment of a particular condition up till 2021, you will get good synthesis of information. But again, since it is the algorithm algorithm that most of these systems use is going to take up information in the order of importance based on the context of how many times it appears and what is there in standard textbook. So it will be, unless there is a huge creation of a negative information on the internet, you will get most of the time the information that you will get will be appropriate and will be accurate. But yes, you have to be aware that there are certain situations where the information is manipulated. Like, say, if you want to look at ECCO2R for COPD exacerbations, you might find that there might be a bias of publication of success. So there might be the newer ones may not be this thing that the data is that there's not much of a benefit, may not come through, but you will get a very overtly enthusiastic view about, say, I'm just giving one instance of a particular treatment that you might get up. But yes, it will summarize it to you very well. And that is also one way of synthesizing information, because it is a kind of condensing together the diverse information that is available on the web. What is appropriate for your patient and whether that thing has been tested is not still out on the open. There are even better versions coming out very soon, right? From IBM has always been with the Watson's series. They've always been there. It's not available for every user, but yes, there are users usage to make sure that this is going to happen. So ChatGPT, as of now, will give you a 95% solid information on the majority of the commonly treatable disease. But the 5%, which is what we are looking for, when we are anyway trying to get it, you may not be the best place to do it.
Yeah. So now we'll come for the final one-liner take-home messages. Since Dr. Sharmili and Dr. Amlendu have raised their hands, we'll come to them towards the end. We'll start with Dr. Suresh, since he's online in camera. So Suresh, your one-line take-home, one sentence on relevance of social media and its impact on critical care. Take-home message.
Take-home message is, I think the society per se should benefit from social media. That means the Indian Society of Critical Care Medicine should be creating public awareness and has done it so far very well, and we should continue to do it very well. Individual doctors, I think, should still desist from doing anything, but as society should use social media to promote and to make sure that everybody understand what our goals are, what we want to achieve for the society, and to create a campaign for positive change in society.
Dr. Khusrao.
Yeah. So a wise man once said that the dose makes the poison. And I completely believe in that. And it would be true even for today's discussion. So use WhatsApp and all your social media in moderation. Don't get completely carried away, and don't make it poisonous for yourself and your health and your career to have an overload of information, because that also can cause problems. And I would say my one sentence here that don't go mad over the social media. And when I say mad, I want a mnemonic here. M stands for the misinformation. So please look out for that. A stands for don't get addicted to it. And then D stands for a decline in your personal health and your screen time and stuff. So basically don't get mad and do it in moderation is my take home.
Sharmili, your comments and your one-line take home.
Yeah, I would say use social media judiciously, but and no WhatsApp consultations. And second line I would add is please follow ISCCM on all the social media handles. It's widely available, and we would continue to do the good work under the guidance and cooperation of all the members.
Dr. Amlendu.
This is not the era of war. This is the era of social media, and we use social media judiciously, adhering to the ethical standards, privacy standards, verifying information, and promoting evidence-based medicine. Thank you.
Dr. Rajesh, your take home and your punchlines.
Sorry, I hope I will be taking more than 2 minutes because there's something which came in between and I wanted to talk. So you know what happens, Srinivas? We just forgot Google in this while discussing everything. Google is the biggest platform of social media. And if I have to discuss, I have to find anything which is normal, first thing I type on Google, and Google give me information for all sort of things. Then it depends upon what information I keep. Now what happened that any RCT which is very well published, maybe positive or negative, NEGM started, and then subsequently all journals started. They make a summary of that, and they started putting first there on Twitter. They started putting on the Facebook, and then they started sending. Even we forgot to mention email. People have our data as email. So everything. Now everybody is sending using social media as a platform for information. Maybe it is NEGM, maybe it is ISCCM, or maybe Rajesh Mishra, whosoever it is. Now it is me who has to decide as a authenticity, whose authenticity is there and what information I can take. This authenticity is not only decided by the credibility you have created, but there are many other things. So if somebody is asking an opinion on a group of 500 people or 600 and is being given there, you cannot simply shrug off. At the end of the day, when patient is sick, you do not ask NEGM or SCCM or give me answer. Either you get answer by your experience, or you ask somebody who is expert in that, and whatever information he gets is a multiple thing. So we have to be very, very clear what we are discussing. We are discussing about the social media use, and it has misuse also. Social media is a platform of disseminating information which can be right, wrong, correct, incorrect. Maybe our guideline, anybody guideline, maybe our trial, anybody trial, maybe anything. It's being put on social media for others to read. For me, when I started social media, I never understood that it will impact the hundreds and hundreds of people in this way, and I will connect it with the world this way. I never imagined. It was just an experiment we did. And with the social media, I could connect across the world. With the social media, I can take name also. Hundreds of people just complimented me that we learned to manage COVID because of my platform. COVID, so many wrong information was coming in best of the possible general. Can you trust that? No, it has happened. And even best of the general has given wrong information and they get biased. So though that bias is an inherited human quality that will remain everywhere. Maybe in the president house, prime minister house, and maybe best possible general. So we cannot just blindly close our eye and trust everything. It's the end of the day, it is our wisdom which will prevail. It's a patient condition which will prevail. We cannot blame anyone that this was wrong something on social media, this was right in that NEGM, or this was wrong in NEGM or right in social media. At the end of the day, it is me who are going to take decision. So just one liner from me, that social media is going to remain with you like your wife. You like or dislike, it will remain with you at least for next 10 years until something is going to come. Or maybe like your husband. And simultaneously, the way you carry on your marriage, same way you have to carry on with the social media. Many things you will not like, many things you will like, many things may be wrong, many things will be right. It is your wisdom, your IQ or your physiological understanding which will decide how you take that information. Thank you, Srinivas, for the opportunity.
Okay, so I will summarize this in a very subtle way. So as Rajesh said, it is because treat social media like your wife. So cuddle discreetly and don't be mad at social media. You can't be mad at your wife, so you can't be mad at social media as well. So it's going to be our friend if used judiciously, but can bite you if it becomes a poison. So that's what I can say. With that, I'll hand this over back to Dr. Pradeep Bhattacharya and Dr. YP Singh for their comments and closing remarks, please. Sir.
Thank you, Srinivas. And it was really a very, very good discussion. And as I got from all the panelists that and their comments that actually we are going through a transition phase. So at the end of the day, where we are landing, we yet have to see. And but the bottom line is that it is the only thing is that how wisely we use social media, that will make the difference. So at the end of the day, that is going to matter. And with that, Dr. YP, are you there? No, I think Dr. YP is not there.
He's there.
I'm very much there, sir.
Oh, okay. Dr. YP, please. Any comment from your side?
Nothing, sir. I think everything is discussed in breadth and length. I will say that anything in excess is a poison.
Yes. So I thank, first of all, our moderator, Dr. Srinivas, and all the panelists, those who have contributed to make this event a successful one. And Dr. Rajesh Mishra, Dr. Khushra Bajan, Dr. Sharmili Sinha, Dr. Suresh Ramasubban, Dr. Amlendu. I thank you all for giving your valuable time and making this webinar successful. And I thank you all the listeners of this webinar. Thank you for today, and we'll see you again on the next webinar of ISCCM.